Hello, it's Dr. Rhonda Johnson. Today is Wednesday, August 25th, 2021, and today I'm going to be giving an update on monoclonal antibody therapy. You know, monoclonal antibody is one of the few medical treatments that doctors have to help people with COVID from getting severely ill. Recently, the FDA extended the use of monoclonal antibodies. And so today I'm going to be sharing this, and please feel free to share this with the Delta variant raging. You may know someone that can benefit from this information. So first of all, what is monoclonal antibodies? What are they? They're synthetic, meaning that they're man-made. They're produced in highly specialized pharmaceutical labs, and they're designed to recognize the spike protein on the COVID virus, and they sort of act like magnets in the blood. They bind these viral particles up and they inactivate the millions of COVID viruses before they can get into your tissues and organs and cause damage. Now, monoclonal antibodies are not the COVID vaccine, and they're not a substitute for the vaccine. So who can get monoclonal antibodies? Well, FDA has advised that they're for adults and pediatric patients 12 and up who weigh at least 88 pounds, who have been exposed to COVID, or to people who test positive and who are at high risk for COVID complications. So now there are two scenarios in which you can receive monoclonal antibody therapy. The first one is the old one. You test positive for COVID and you need monoclonal antibody treatment. So in this case, you have to be high risk for developing severe COVID-19 infection. You have to have a positive COVID test, and you have to be early enough in your treatment course. And you can't be admitted to the hospital, because if you're that sick, monoclonal antibodies aren't likely to work for you. Now, certain conditions are considered high risk, and this list is not comprehensive, folks. You need to always discuss with your doctor whether or not this therapy is right for you. So people who are 65 years and older in terms of their age, people who are obese or overweight, pregnant women, individuals with chronic kidney disease, folks with diabetes, those who are immunosuppressed, people with high blood pressure or heart disease, those folks who have chronic lung disease, and that could be COPD, asthma, cystic fibrosis. There are a lot of conditions that cause chronic lung disease. Folks who have sickle cell disease, those who have HIV, AIDS, people with nervous system disorders, children who have complex medical conditions, and adults and children who need medical technology, who are dependent on medical technology such as oxygen or tubes or tracheostomy to live. Again, this list is not comprehensive, and you should always talk to your healthcare provider. The one time you need to have a doctor is when you have COVID or when you've been exposed to COVID. All right, so then the next scenario is this new preventive use. That's for people who are high risk, who have just been exposed to somebody with COVID now and been in close contact. Now, the CDC defines close contact as someone who's been within 6 feet of an infected person for at least 15 minutes in a 24-hour period. And these high-risk folks are the same high-risk folks that I just described. So for both scenarios, preventive and for those who are already positive, you need to give the monoclonal antibodies as early in the course as possible. So if you've been exposed or you know you have COVID, please call your doctor or go to an outpatient treatment center, such as an emergency room, and see if you're eligible for monoclonal antibodies. And first see if they have the monoclonal antibody treatment, because you have to get it in an outpatient setting. and it has to be given by IV. It takes about an hour for these monoclonal antibodies to be infused via IV, and then you need to wait about an hour or so for monitoring for side effects. Now, what happens when you go home? Most people generally feel much better within a day or two, but you still need to maintain isolation because you have COVID or you have had exposure for 10 days, folks. Now, in terms of the Covet vaccine, the CDC guidelines recommend that you wait at least 90 days before receiving a Covet vaccine after you've received monoclonal antibodies. That's whether it's your first COVID shot or after your second dose. You know, if you've had a first dose, you get COVID and you get monoclonal antibodies and you were due to have your second dose within 21 or 28 days, no, you gotta wait. You gotta wait 90 days after you've had monoclonal antibody treatment. And yes, you still need to wear a mask, wash your hands, and social distance. So monoclonal antibody treatment can be life-saving for those who have COVID and who are high risk. Make sure you know about this therapy, folks. Be sure you talk to your doctor if you're diagnosed with COVID or you're in a close contact situation with someone who has COVID and you're high risk. I hope that's helpful. Again, I'm not trying to replace the advice of your doctor. Always talk to your personal care physician about whether or not the monoclonal antibody treatment is right for you. And as always, stay safe, folks, and have a blessed day.